today. Has everybody got themselves in some situation here where they can see most people? If you're in gallery view, or I'm not a Teams person, so I have limited ability to help you sort that out, but somebody can. So if you can do that and then people can mute themselves, that'd be great. So welcome to the November 9th meeting of the Advisory Council to the Office of Victim Services, the Connecticut Advisory Council for Victims of Crime. I am Susan O'Million. I'm one of the co-chairs, so I want to welcome everybody. And we do have a guest today who is Megan Scanlon, who's going to be introducing herself in a minute. Just another reminder that we are being live streamed on YouTube, but we're not being recorded. So welcome anybody out there on YouTube who's listening to us. So I wanted to start the meeting. Okay, I wanted to start the meeting with some welcomes and introductions. What I thought we would do, because Megan's here and I know people would like to hear a bit, have her introduce herself, but I thought we'd introduce ourselves first so she'd have a good idea of who we are and what we do, which she may already have, but it's always great. And there are some new people who've come on the console, so it's always good to go around and do that. So if you can say a little bit more about who you are and where you work, that'd be helpful. You don't need to do, your 10-page biography or your resume, but just a little bit more about what you bring to the console. So I will start, and I think what I'll probably do is I'll call on people. I usually have people call on each other, but for the sake of who can see who and who cannot see who, I'll try to do it that way. So I'm Susan O'Million. I'm an attorney. I am currently working with women who come through domestic violence and sexual assault, child abuse, helping them move from victim to survivor to thriver. This is work I've taken up after my niece Maggie was murdered by her ex-boyfriend about 20 years ago. I have done this work for many years, including working in state governments, so at the Office of Policy and Management and at the Department of Children and Families. And I'm one of the co-chairs. Our other co-chair, who's actually new to us, so I'm going to have her introduce herself. I think this is our second meeting, is Judge Laura Baldini. Judge, would you like to?
Good afternoon, everyone. It's so nice to see so many familiar faces. Susan's correct. This is my second meeting. Looking forward to working with all of you. I am a Superior Court judge. I presently sit in the New Britain Judicial District and I handle criminal matters. Great.
All right, and then let's start from, let's see, the top here. How about Beth Hamilton? Do you want to introduce yourself?
Sure. Good afternoon, everyone. I think I probably know most of you at this point, but my name is Beth. I'm the executive director of the Connecticut Alliance to End Sexual Violence. We, much like CCADV, are a membership organization of sexual assault crisis services programs throughout the state, and it's a pleasure to see all of you today.
Great. And then Jessica.
Hi, good afternoon, everyone. My name is Jessica Pisano, and I'm the Director of Victim Services with Survivors of Homicide, Inc. We are a nonprofit organization that provides counseling, support, and advocacy to family and friends of homicide victims.
Great. And then let's see, Debbie.
Hi, everyone. I'm Debbie Whitkin, the Executive Director of Connecticut Legal Services. I also have a stepson who was killed approximately 15 years ago in a sort of a matter of being in the wrong place at the wrong time kind of situation. And I've been on this advisory committee for several years and I'm glad to be here.
Great. Jerry.
Good afternoon, everyone. Geraldine O'Neill Wild. I'm one of the directors of legal advocacy with the Connecticut Coalition Against Domestic Violence.
Okay, and then Mark.
Hi, good afternoon, everyone. Mark Pelka, Undersecretary of Criminal Justice Policy and Planning at the Office of Policy Management. This is my second meeting at the Advisory Council, and very excited to be around everyone again. Our division administers several state and federal grants, including the Violence Against Women Act, and we produce an array of research reports on a monthly, annual basis. An ad hoc basis as well. We released our annual Trends in the Criminal Justice System presentation last month and enjoy partnering with many members of this group to incorporate the National Crime Victimization Survey and to explain the various ways of victimization, victim need, and victim services can be quantified thanks to the tremendous work that many of the victim service organizations here provide. Thank you so much.
Thank you. All right, and I was just trying to call on the members first. So let's see, Amy Lupoli.
Yes. Hi, I'm Amy. It's Lupoli. I know.
I'm going to work on that. Thank you, Lupoli.
Okay. It's okay. Lupoli always sounds very fancy, and then when I correct, I always say it's Lupoli. My name is Amy Lupoli. I'm the Senior Director of Clinical Services at Klingberg Family Centers. We're a nonprofit organization. We provide many different types of services, such as mental health and advocacy for victims of crimes in various parts of our programming. I also oversee our Child Advocacy Center that's located in Hartford, where we provide advocacy, forensic interviewing, and is also part of multidisciplinary teams for victims of crime, particularly mostly children.
All right. Amy Lupoli. All right. I'm going to work on my Italian here. All right. Yvette.
Hello, everyone. Yvette Young, Associate Vice President of Programs and Advocacy at the Village for Families and Children, which is a behavioral health organization in Hartford. And I'm also the co-chair of our Human Anti-Trafficking Response Team, which the primary focus is on response for trafficking victims.
Great. And I think the last person who's a member of the council is Irene, who's on the phone. Irene, do you want to introduce yourself?
Sure. My name is Irene Michael, and I'm a Victim Compensation Commissioner for the Office of Victim Services. Thank you.
Okay, thanks. I think that's everybody.
Ebony is on also.
Oh, did I call on I'm sorry, Ebony, yes.
Hello, Ebony Suggs. I'm with the Department of Correction. Our Victim Services Unit, we function as a notification system for victims as well.
Okay, thank you. I'm sorry, I had your name and I didn't cross you off. All right, so that's everybody who's on the council, who's a member of the council. So now I'm going to just jump in the people I haven't ignored you. I was just trying to give us a little bit of structure here. All right, so let's have let's see. Oh, Andrew Woods just came on. Andrew, do you want to introduce yourself? He's a member of the council.
Sure. Good afternoon, everyone. Andrew Woods, Hartford Communities That Care. I'm glad to be here.
Great, thanks. All right, and then Adam, do you want to introduce yourself and anybody else who's with your team there?
Definitely can. Good afternoon, everyone. My name is Adam Johnson. I'm from Market Decisions Research. We are fielding the 2021 Connecticut Victim Experience of Care Survey. And also on the line is the president of Market Decisions, Patrick Madden.
Okay, and Patrick, do you want to check in or?
Yeah, no, hello, happy to be here. Adam already introduced me, so I won't introduce myself again. But again, we're really excited to be here to present some of brief amount of findings about what we've found so far and basically an update on the process itself, which is currently ongoing. But again, appreciate the time.
Yes, there's phone calls being made and people being interviewed as we speak, huh?
A lot of stuff going on.
Yeah, great. All right, and then I think I covered everybody except for the OVS staff. So Linda, do you want to start?
Sure, Susan. Hi, nice to see everybody. Linda Cimino, Director, Office of Victim Services. And Susan, if it's okay, I would like to ask Mary Kazicki to introduce herself. I'm very happy to announce that Mary has joined us, came back to us, and is currently serving in the role of Deputy Director. So Mary, would you?
Oh, this is exciting. Yes, let's.
Yes, it is.
I think I saw her on the panel, and then maybe because people are shuffling around, I don't know.
I see she's still on, but
yeah, she's still on. All right, some point later we'll have her pop up and say a few words. That'd be great.
My apologies. I was talking and was muted. So.
Oh, all right. So why don't you go ahead? Yeah. So I thought there was a new person and I wasn't sure. But go ahead, Mary. Welcome.
Thank you very much. I am very excited to be joining the conversation. I began my career here with the Office of Victim Services in 1998, served as both a juvenile advocate and an adult advocate out in the Tallinn court, working in both Part A and Part B cases, and then became a supervisor and was a supervisor with the office for about 8 years. Briefly moved over to Court Support Services Division, and again, I'm very excited to be back in the role of Deputy Director. It's wonderful to see so many folks that I've interacted with over the years, and very nice to meet those of you that I hadn't had the opportunity to meet before.
Great. Well, it's great to have you on board. All right, and then Jim Morgan.
Hello, everyone. Jim Morgan. I'm Program Manager here at the Office of Victim Services. I'm responsible for administering the Victims of Crime Act money that we receive from the Office for Victims of Crime.
Okay. All right. I think we did everybody. We popcorned around here. So is there anybody I was missing or needs to say anything more to introduce themselves? Great. All right.
Susan, yes. This is Jean.
Yeah, Jean, I'm sorry. Oh my gosh, how can I forget Jean, the one who keeps us all together here? Go ahead.
That's okay. Hi, everyone. I'm Jean. I'm with the Office of Victim Services. I wanted to just clarify that the meeting is not only being live streamed, it is being recorded and saved for future viewing.
Okay, thank you. So we are being recorded. All right, excellent. All right, with all of that, thank you so much for in the introductions around the circle. I wanted to, I made an effort to invite Megan Scanlon to come and talk to us. She and I were on a NPR radio program a couple weeks ago on the Gabby Petito case. So I introduced myself and then I invited her. So I know it'd be great to meet her in person. Some of you may already know her, and I think she knows some people here, but I thought it'd be great to have her come on. And just introduce herself, and so people can say, oh, I saw her on that little screen a while ago, and I want to check back with her. So Megan, the floor is yours.
Thank you, Susan. Yeah, so for those that don't know, although I think I have at least met most of you virtually, which seems kind of funny to say, and some of you in person, but for those that I haven't, my name is Megan Scanlon. I am the new, I guess newish now, because I'm 4 months in, so I don't know that, I think the new has kind of worn off a little bit already. CEO at the Connecticut Coalition Against Domestic Violence. For those that don't know, we are a coalition made up of 18 sites across the state, and our main focus is to provide services to victims of domestic violence and their children, from legal advocacy to housing advocacy and everything in between. So it's certainly a pleasure to be with all of you, and I look forward to getting to know all of you over the course of my time here, and certainly welcome any opportunity for feedback, outreach. So anything that you think might be of interest to any of the organizations on here. Obviously, a lot of the work that we do intersects with all of you. So I'm certainly open to new ideas and new collaborations and new partnerships as we try to address a lot of these bigger systemic issues together.
Great. Yeah, and that's one of the reasons why, CCADV has been a part of this council for many years. Jerry Wilder is a fabulous representative of CCADV, but I wanted Megan just to get a sense of the opportunity here and to come and present. We try to allow a forum for people to bring their projects, their reports, their issues, legislative, in whatever way you're trying to collaborate. So it's a great place to have kind of like a one-stop shopping, right? That you can get a good group of people in a place. And that's certainly how I've seen the role of this council as co-chair. And Judge Baldini and I had a great conversation the other day. We share that value, so we're going to continue to do that. All right. Thank you very much, everyone. We're looking like the Hollywood squares here. It's great. So I'm going to turn the co-chairing over to Judge Baldini for the next two agenda items.
All right. So I don't know whether we did we approve the minutes yet? I know.
Oh, I'm sorry. We did not. Do you want to do that? Go ahead.
Well, we have the minutes. You should have gotten them when you got the invitation to today's meeting. Attached to the meeting invitation that you all got were a variety of things to include the minutes from the last meeting. If you were not at the meeting, you can abstain from the vote. If you had a chance to review them, we're going to have a vote on them. We also had some other attachments, which we're going to be going through in the agenda today. So first order of business is to address the meeting minutes from the last meeting. Is there any discussion before we take a vote on it? Are there any changes, additions, or corrections anyone wants to have put on the table? I am hearing dead silence. So either you're all on mute or we don't have any changes, additions, or corrections. So with that, would someone like to make a motion to approve the minutes from the last meeting we had?
So moved. This is Debbie Whitkin.
Thank you. And if you are making a motion, it's appreciated if you can just say your name. So we've got Debbie Whitkin, who's moved. Do we have a second?
Mark Pelka, second.
Okay. Any further discussion? Okay. All in favor of improving those minutes from the last meeting?
Aye.
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 Anyone not in favor of approving them? Okay, hearing none. And then any abstentions? All right, so it looks like those minutes are unanimously approved. And at this time, if we don't have anything further on agenda item number 2, we can move to agenda item number 3, which is a somewhat broad topic. That's the OVS report. I know that we're going to have to cover budget statements, the criminal injuries fund report. Those are things that were attached to the invitation that you should have gotten. So with that, I'm going to open the floor so that we can get that information on the table for discussion. So I know Linda and James are probably going to be talking. I don't know how you want to allocate the discussion, but we can go to that agenda item now.
Judge Jim can do the CICF first.
Perfect.
I'm going to go over the updates that we have for the Criminal Injuries Compensation Fund. The monthly update we passed out for the expense statement that's through October 31st. Through October 31st, we've spent $961,000 for compensation payments. It's about $220,000 higher than October of 2020, due mainly to the significant increase that we have in the number of claims coming into the office. If you have the sheet in front of you or you've seen it before, we do have sufficient state and federal dollars to cover our expenses for the year. If the expenses keep trending higher, we have multiple open federal grants that we can always tap into if we need them. So there won't be any problem as far as having to delay payments or anything like that during the year.
That's a good relief, Jim. Excellent.
Mm-hmm. Yes, it's also a benefit with the new VOCA changes as far as increasing the calculation for our compensation grants. So we should be getting higher grants each year. So that'll always be a help. So
yes, that's something we've been talking about with the impact of the federal legislation on VOCA and the fix that went through Congress recently. Great.
Okay. The other sheet that we passed out is the court collections. Those are through September 30. There's always a 1-month lag in the posting. Through September, the first 3 months of the fiscal year, we've received $289,000 in court revenues. That is $103,000 higher than last year. So that's good news. I think with the reopening of the courts and just the increased business, the revenues are starting to increase back into the fund. And our overall revenues are about $250,000 higher than last year. So I think we're trending upwards, or at least it's not decreasing anymore. I think it's a good sign that the revenues are starting to flow back into the fund. So
great. Yeah, that was a little scary. Well, we knew it was happening because of COVID, but that's great. That's like, we're trending like on social media. That's pretty exciting. Good job.
I think that's it. That's all I have for the criminal injuries fund updates. So.
Okay. Susan and Judge, if it's okay, can I ask Patrick and Adam if they want to go next, so that we're not taking more of their time than necessary?
Sure. So we had that on agenda item number 4, but we can move to that if you'd like. We could do that at this time. So if you want to give us an update on the OVS victimization needs assessment, we can do that right now.
Definitely happy to, or if you want to get to us on the agenda item, flexible either way.
Well, then I'll go, we'll stay with you. I was just trying to be.
I appreciate the thought, Linda, thanks.
Okay. So we have some updates. Mary, please jump in if I've left something out. We were able to, as I think as reported in the last meeting, we have been very fortunate to have the ability to hire numerous victim services advocates to fill positions that have been vacant for up to 8 years. So we're very, very happy about this. And we had our first new victim services advocate begin last Friday, the 5th, current judicial employee, and she will be assigned to our helpline and will be filling the vacancy left as our then advocate is moving up to Hartford, GA. And Mary, Corin Butler Kurth, Al Magris, and Jody, and I never say Jody's name right, sorry, Mary, Chenard.
Chenard, exactly. Well done.
Chenard. They have just concluded a Herculean interview process, 6 days, 36 candidates for 8 positions. I'm not sure their hands have quite recovered from all that writing, but Mary and I have been chatting, and we have our 8 recommended candidates, and we're waiting for the paperwork to be completed before we submit that to Human Resources. And I want to thank Mary and Al, Corin, and Jody for doing that. That was an extraordinary feat to have that done. And again, so many vacancies are being filled. As far as our compensation program, as of the end of October, we have entered 1,686 applications. This represents 555 more than we took in the 12 months of 2020. Wow. And it was 9 less than we received in all of 2018, which you may remember was our historically high year, which now 9 days into November, we've already surpassed that. We're well into the 1700s. And that's in part to the great working relationships that we've fostered with CCADV and Jerry, you working with Rachel on the compensation work group. Andrew's group is fabulous in getting victims to us, and everybody else. I don't want to, Beth, it's been a great, great collaboration over the last couple of years. One of the issues that I mentioned last time is that we're experiencing a higher than a record high number of emotional injury claims, which is good but difficult at the same time. There are advocates who are across the state, not any particular agency, but they're encouraging or assisting victims to apply for benefits for us when the crime has nowhere near anything we can cover. So unfortunately, we're starting to have to deny claims. So our numbers are going to be a little up on that way, but we are working to educate advocates that there are certain kinds of crimes that we by statute can't cover. So we are managing that. And lastly, for compensation, I just wanted to give an update. The average caseload per claims examiner right now is topping 200. And that's really very significant for us. considering the amount of time it takes to develop any one of these claims. It could be hours to weeks. And then in addition to this, we are probably 5, 7, 10 times a month getting old claims. We just had a claim from 04 was just reactivated because someone needed services. So we have all of those out there that can possibly still require services, plus the ongoing. So there, our 5 advocates are very busy, and we continue to try to get 2 more claims examiners to significantly lighten that load and make it more reasonable. I have 2 more updates. The SAFE program, as I announced at the last meeting, we were about to launch our fall class. That did happen. 11 medical providers, all nurses for this class, completed the course last Saturday. And this Saturday, Denise Covington and Pat Moriarty led half the class for last week and then half the class this coming Saturday through an 8-hour clinical, where they learned techniques for speculum exams and completed those. And then next week we start the mock exam. So we're hoping that by beginning of December, these 11 will be able to be on the calendar for responding, because as we mentioned the last time, our numbers continue to go down because of the impact of COVID and the absolutely stressful environments that they work in, as almost all of our nurses are emergency department nurses. 2 more things. After a vacancy of almost 10 years, we were able to post for, and we have hired a trainer. We took one of our very talented victim services advocates who served in a training capacity with me. So Alex Gittness began with us a couple of weeks ago, actually on 10/22, and she has jumped right in, already doing trainings, and is working with Mary, Corin, Al, and Jody on the revision of the training manual for the victim services advocates, which it's over a 40-hour class. So there's a lot of work, and very exciting to have her on. She will be taking on our post trainings, our contractor trainings, and she and I chatted last week about opening up our training opportunities to new individuals and groups that we haven't, using the information from the survey. And lastly, by statute, our biennial report is due to the legislature on January 15th. I am working on it. We've had some staffing changes, which has kind of put the creation of this in a little jeopardy. But myself and the rest of the management team are working very hard to complete this and meet our statutory responsibility. That's it, Susan and Judge.
Thanks.
Okay.
I had a question.
Any questions for anybody who's presented or given information?
I had a question, Linda. Just a clarification. I think I got this right. So they were talking about some of the claims are going to be denied because they don't cover the crimes aren't covered, and then something about is emotional injury covered under the fund or not, or is that a change that has been happening?
We were able to create a new level of claims back in 2018, which was emotional injury, which by statutory definition is the person is in direct threat of physical harm or murder. And there are a variety of crimes that we can consider under that. But unfortunately, we need to do more education of our nonprofit partners. So if someone comes in with like a car theft, and yes, they were traumatized because their car was stolen, but that's something we can't cover. If they weren't in the car, there was no direct threat of bodily injury, we can't cover that. If they just woke up in the morning and their car was gone. So there's certain crimes like that, that yes, there is an emotional harm to it, but it doesn't meet the statutory requirement. So I've been talking with Rachel, and we're going to kind of double back to the agencies that are seemingly submitting more of these than we should, and we'll be kind of doing some direct education on that.
Right. Thank you.
All right, any other questions or comments?
I just wanted to say, Linda, this is all very exciting news. It seems like there's a lot of positive going on right now, a lot more, people going into the courthouse, a lot more resources. And I think, during the past 2 years, we've kind of seen things cut down and had a lot of worries about that. I just feel like this is a really positive step in the right direction, especially for crime victims. So.
Thanks, Jess. I really agree with you.
Okay, so I think that concludes our agenda item number 3, which then brings us to agenda item number 4. And I think, Adam, you were going to present sort of an update on the OVS victimization needs assessment. I think you had some help with you today. So if you could share that information with us, we'd appreciate it.
I'd be glad to. I did send over some slides. I don't know if Jean, maybe you're able to throw those up, or if someone is able to put those up for presentation.
Okay, I'll pull them up for you. One moment.
Thank you. While those come up, just a brief rundown. As a reminder of the general scope of the project, we're doing a three-tiered project across victims' experiences in the state of Connecticut. Our ideal timeline will have us starting back in April with survey development and sort of understanding the topics that are of interest. And ideally at the end of this April 2022, we'll have some final results for everybody to review. So let's see here. So I've sort of broken down where we're at on a project basis. The first project is our quantitative survey. So this was a rigorous statewide victimization survey. We're using a mixed mode approach. So it includes both a push to web mailing. So that is letters sent to geographic locations around Connecticut, including a QR code and a prompt to go to a stated URL to complete the online survey, as well as we've begun some phone follow-ups to areas of interest, normally to help push up response rates among interest goals. Among those, we have goal states to get response rates of. So particularly counties, as well as some demographics. We also have done a two-sided type of survey or two-sided type of sampling for the survey. About 50% of our responses come from a panel sample, and 50% are general population randomized sample. So ideally, we are currently reaching the end of the data collection for the online survey in Project 1. We've seen some very strong responses across most of the counties of Connecticut. There are a couple of counties where we're slightly below our targeted goal number of completes. These include Litchfield, Middlesex, and Windham. We're currently targeting our phone follow-ups at those particular areas in order to help drive up responses to provide a threshold of surveys that we can use for analysis. Right now, the demographics of those who have completed the survey mirror where Connecticut is at overall. I pulled up some data from the American Community Survey from 2019, and the demographic breakdown of the survey respondents that we have is currently right at where Connecticut's population is in general. So we have around 13% of the respondents identify as Black or African American. 73% identify as white. We have some small response populations in American Indian, Alaskan Native, Asian, Native Hawaiian, or other Pacific Islanders. So a very wide breakdown of Connecticut residents have done the survey. We've also done a particular work to make sure that all income levels are represented. So according to the ACS, the median household income is around $78,000 in Connecticut. We have about 53% of those who have completed the survey fall at a reported income of below $75,000. So just in the sort of goal to reach populations that might be underserved or that might have less access to services, looking at that, those subpopulations are kind of what we've aimed for. So we are on slide 7. Couple more. Awesome, thank you. So project 2 is being built off of project 1. Actually, the person who is conducting most of the interviews for project 2, who otherwise would have attended today and provided more in-depth update, is actually conducting one of these interviews as we speak. So just as a reminder of what project 2 is, we are doing a series of in-depth interviews among those who have been victims of crime in underserved communities to understand their experiences, as well as how victim services can better meet their needs. Next slide, please. So a lot of the topics that we're asking about in the in-depth interviews are one that are of a sensitive nature, and that these IDIs provide a safer and more confidential environment just to get more detailed information on what people's lived experiences are. Ideally, we're going to complete around 50 of these interviews. Currently, I think we are sitting at 8, and I can talk about what those demographics look like with the next slide. The 8 interviews that we have completed as of yesterday, we had 6 scheduled today, so this is likely slightly out of date, provide a pretty wide variety of both crime types as well as location, age, gender. These are pretty similar across race or ethnicity, but the interviews we have scheduled break that up a little bit. We've also got a well-represented breakdown across income groups and education. Next slide, please. So these are interviews that we had scheduled as of yesterday. We have sent out another email outreach to those who have completed the online survey and indicated they might be interested in completing an interview to go in more in depth. That's where these people have been drawn from. As you can see here, we've got another nice breakdown of different crime types, as well as a larger mix of race and ethnicities, as well as ages. So I do have, after speaking with Allison, a breakdown of the sort of rough top line findings from those 8 interviews. Next slide, please. So the sort of 4 main themes that Allison talked to me about, and granted, these are after only 8 interviews, so less than 20% of the overall data collection. But those that she's talked with, or that the team has talked with, report pretty polarizing interactions with law enforcement. Either respondents are strongly in favor of the interactions they had, or they had very negative interactions with law enforcement. And those with negative interactions with law enforcement sort of have retained that negative emotional response around that interaction, regardless of the length of time from the interaction or the crime experience. Women respondents also report a strong theme of disbelief, both around their reported experiences with law enforcement and service providers, as well as from their greater community at large. And respondents who have had interactions with OVS have a very positive initial assessment of the context and support that they've received, but they do say that the follow-up interactions leave something to be desired. So very strong and helpful initial correspondence, but then things have fallen off for these people. So where is this all going? I've provided a breakdown of our sort of future milestones. Next slide, please. The online survey should be closing out at the end of this week. And then we should have initial findings available either at the end of this month or the beginning of December, depending on the length of the analytical time necessary. We are currently developing our analytical programs, which will allow us to sort of turn that around a bit faster once we have closed out data collection. So this portion of the project is in the wrap-up stages. For the in-depth interviews, we'll be continuing to complete interviews until we've finished 50 of them. Our rough timeline has that coming about the middle of December, but we've also seen a very strong response to these initial outreaches. So I wouldn't be surprised if we end up finishing out the in-depth interviews a bit before then. Although with the holidays coming up, it is a little bit of a wild card. Once Project 1 and Project 2 are complete, we'll have a synthesis of those results, and we'll put that together in an executive summary. Ideally, that will be completed mid to late January, and that will inform Project 3, which are focus groups with service providers. And then once Project 3 has been completed, we should have final results for the entire project in April of next year. So that's sort of where things are at with this outreach. Does anyone have any questions about that?
Adam, just one quick question about the focus groups. How are you going to do them? Are you going to try to do them remotely or in person or a combination of those things?
We've had some really good responses with remote focus groups, either through Teams or some other platforms. So I think our initial goals will be completed remotely, but we'll investigate in person if it becomes necessary.
Does anyone else have? I see we have a question from Mark.
Yes, thank you, Judge. Thank you so much for your work. Last week our division released a annual kind of trends in Connecticut's criminal justice system report, and we cited the UCR crime report and then cited the National Crime Victimization Survey, indicating how that is a nationally representative survey and does not yield Connecticut-specific insights. It also indicates that only a minority of crimes that victims experience are reported, and how eager we were for more kind of centered, victim-provided input regarding victimization. So we tried to lay a platform for the eventual data analysis that will come, and we're so excited to complement the current kind of data analysis with this information. I was wondering if you have got insights about kind of victims' referrals to services. It was very interesting to see kind of differences in victims accessing services, whether they reported to law enforcement, whether they what types of crime they had, and other factors. Are there any insights that you're gleaning so far as yet about the need for services, the ability to access services, anything to that degree, Adam?
Nothing that is sort of out of hand right now, just because we're still in the middle of analysis of the survey data. Although it has been a very interesting sort of task for the analytical team to sort of look at what are their sort of larger data sets or resources to compare against for this type of work. And it does seem to be that there is a pretty big gap in this victim-focused research around experiences. So it's going to be a pretty fun waiting and analytical cycle for our main analysts.
That's great. And my final question, if the judge would allow one more, is just about, are you finding any particular demographic groups or constituencies that are either underrepresented or have emerged in the data analysis that the team is eager to learn more from in the interviews? Again, I appreciate your, just as of the last meeting we had, you're right in the throes of the analysis, so forgive me for leaping ahead, but any insight you could share, I'm just quite curious. Thank you.
No, I wish Allie was here because she'd be able to provide you with a little bit more answer on especially how we're doing the IDI selection. But Patrick, do you have any insight that you might be able to share there?
Yeah, I'm happy to jump in. So I think two things. So one, I think with regard to the in-depth interviews, so Alan and I really sat down and sort of planned out that outreach, which is really critical, right? Because it's really important to get a wide variety of experiences from different types of people, right? And we want sort of a really broad representation of that, around the state of Connecticut. So really sort of deliberate in terms of how we made that initial selection of those we wanted to reach out to, not just in terms of the types of crimes that they experienced, which again, we wanted to a sort of broad range of experiences, but who we were reaching out to in terms of those demographics. So again, as Adna mentioned, it's really key that we reached out to specifically to racial and ethnic minority groups and make sure we had good representation there, had representation across different geographies. So I'm really happy with that sort of initial sample that we had for outreach. So I do believe we're going to get some really great results coming out of both of these things. But I think particularly the qualitative interviews, I think will be really enlightening once we get a chance to look at that data in a little bit more detail. And I will just say anecdotally, and again, this is just based on sort of one interview that I talked about to Allie about who did this, was she had an interview with a woman who had some serious mental health conditions. And basically, from her experience, sort of those mental health issues basically clouded everybody's judgment on her experience. And so when Adam had mentioned sort of the disbelief around these crimes and what people are experienced, it was really that mental health component where people are like, well, this is just, your mental health issues acting up. This really didn't happen. You're exaggerating this. So I think one of the things you'll find, and we'll probably find many things out of this, but I think it's pretty clear that, people's sort of mental health is going to play such an important part in terms of how they're experiencing this and whether they're getting the services that they actually need. And in some respects, even whether people, believe their story in terms of what they're saying. So that really can be a pretty deliberate, a pretty, just an issue that's really insurmountable in some cases to overcome. So again, that's very anecdotally just based on one of those interviews. But that's sort of the type of thing we're getting out of this thing. So I think it'll be ultimately extremely valuable.
Thank you, Adam. Thank you, Patrick. Very excited.
I see, please.
Beth, we've got a question from you as well.
Yeah, I mean, I guess it's part a question or part of thinking about the analysis and part just in honoring of one of the things you put up there. And that is, I think both you and Mark are hitting on the sort of universal experience of women and girls, right? And the disbelief around their experiences as victims of crime. I think that probably cuts across all of the disciplines that we work in. I wonder if you're able to provide, as you think about this contextually, right? Like we understand and we experience that in victim services, particularly I think probably in domestic violence and sexual violence. I wonder if there's more of a gendered lens that you all plan to put on, right, to think about who are the victims of crime versus who are believed by some of the institutions that are responding to victims of crime. And I think it's one of the places long term to think about the ways in which we can use this victim needs assessment to really highlight that to go towards policy change. Because I think while we know that, and we've known that for decades about folks' experiences, it's really challenging to institutionalize policy change based on those experiences. So I love that it's in there. I wonder if there's a way that you're sort of thinking about long-term, both using that larger gendered lens to think about it, but then also how can you make policy recommendations based on those specific outcomes that you're finding for many of the victims that you're working with would be something I'd be super interested to hear more about as the process moves forward.
Yeah, I think that's a great point. And I think in terms of one of the first steps that comes out of this is actually quantifying the issue, right? So a lot of times we know anecdotally that this is happening. One of the great things that comes out of this needs assessment is actual data that you can point to say like, okay, we know this is a problem, but here's actual statistics, actual results that actually prove what's going on. And that will lead you to the second step, and ultimately the more important step is, well, now what do we do in terms of policy to actually address this? And I think, as Adam mentioned, one of the outcomes of this is sort of a comprehensive needs assessment and report. Well, we will definitely think about that and certainly make our recommendations on what we're seeing out of the data. But that ultimately will come to, this council too, and other people as well. But hopefully, one of the long-term outcomes of this is sort of you guys using this data to really talk about how you want to, advocate for policy within the state.
Judge, I had a question following up on Beth. So do we know if there's any data nationally about girls and women not being believed? Or I agree with Beth, this is a huge issue, and I had never thought about how you could collect data on that.
There are some studies, Susan, that do sort of point to it, but again, they're not like these, they're not victim needs survey. It's a different sort of type of study that would orient folks to those outcomes. So there are research studies that exist, but this is a particularly unique way to collect that information and to sort of put it in, I don't know if it's like elevate, I don't know the right, I'm struggling a little bit with how I think about it, but like I think about CJPAC, right? Can CJPAC have a conversation, right, about the fact that women and girls are not believed when it comes to being victims of crime, because we now have data that collects it. So it doesn't necessarily situate it in that larger conversation in institutions, but there is data that exists to say that that is a relatively universal experience.
And Beth, I agree with you, and I thank you for saying that as well. And I think, and adding maybe another layer to that and how that correlates to mental health, because it's not often unseen that we have victims, in our multidisciplinary teams where the first thing comes up is their mental health status and how that determines how things might be investigated or moved further in terms of how things are going to move. And I think that's a huge impact that I think we're making strides on these smaller level lenses, but it would be great to see something more kind of comprehensive about those studies.
That would be really interesting data for Connecticut to have that would move the issue forward, not just as, documenting that this is happening and not just in one person's life, but it is across the board. And I think it also would be, various places in the system, like the law enforcement, the court system, the victim advocates. The Gabby Petito case is a great example of the police just not seeing it, and she was telling them her story, but they were listening to something else, or they were hearing something else, I guess. So, it's been an issue. It's been around for a long time, and I guess I suddenly could we solve this problem? Is kind of what I'm thinking. And what would be the change that would be made? And sometimes I think it's in people's attitudes, and maybe that's what. And I've done this work for many years, and I've seen people's attitude about domestic violence and sexual violence change, but I can't point to exactly what it is that's made those changes. Maybe it's just more education. I don't know. That's an interesting question. Or what the victims might say as to what could have been different. And is that a matter of procedure, policy, education? I don't know.
I see somebody else has their hand up, but I don't have their name identified. So
I think it's Jessica Pisano.
Oh, Jessica, go ahead.
Is it? Okay, because it just doesn't show on my screen. So my apologies.
No, it's
go ahead, Jessica.
Okay. So I just kind of had a random thought. I'm putting on my direct service hat a bit. This may have been discussed in the past, but after these interviews, are you able to give the victims you're speaking with any warm lines or counseling resources? Just looking at your timelines, it just kind of was in my head that the holidays are really a hard time for people in general, and especially victims of crime, and it can really bring up a lot of emotions and feelings. So I was just thinking in terms of between the interviews bringing up feelings and holidays, I was just curious the kind of resources that you were referring people to.
Yeah, for both the online survey as well as the in-depth interviews, we provide, I think, some phone numbers for OVS that Linda has specified for us, just in order to help people get that support in case they have any issues that come up from them.
That's what I thought. I just wanted to double check. Thank you very much.
And Adam, correct me if I'm wrong, please, but I thought we also provided Jessica the number for Jessica's organization and Mothers Against Drunk Driving. And did we pare it down just to OVS?
I would have to go back and look. I think we may have pared it down to OVS and then OVS to be a clearinghouse to direct people as they need.
Yeah, and Jessica, the helpline numbers has been everywhere on this.
Absolutely, and it's so funny. I actually just gave it out to someone earlier in the week. They got some misinformation and their offender dropped off the DOC inmate list over the weekend, and they panicked a bit, weren't able to get a hold of anybody. So I made sure I made the referral over, and he's in federal now, so it's not like he escaped. But yeah, I've been using. It's been very helpful for people, especially after hours.
Okay, any further questions or comments from anyone? All right, Adam and Patrick, thank you so much. Obviously, you leave a big question mark that we're going to be looking forward to the next meeting and the updates and the good stuff that you're doing. Thank you very much. At this time, I'm going to turn it over to my coach, who's going to hit the next agenda item. Susan.
Yes.
Thank you.
Thank you very much.
Thank you. Thank you, Judge. I just wanted to mention, I think that both Debbie and Amy need to leave at 3, so just wanted to say thank you for being here, and that they're not going to be able to continue with the rest of the meeting. There's a couple of things that we have regularly put on the agenda. One has been a series of roundtable discussions, usually new business, and then of course adjournment. So I wanted to go back to the roundtable discussions. These have been on the agenda for a while. Some of them are regularly on our agenda about legislative and proposals and issues, state and federal, and then the impact of COVID, and particularly now the vaccination rollout. But I was remembering, Beth, from the minutes of last time that there was a small group that you were putting together. And I'm sorry we didn't actually put it on the agenda. Is there a report, or even to just put it back, just to let the new members or whoever wasn't here last time, just to what topic that is about and who was interested in perhaps joining you?
So I don't, Susan, have an official report, and I apologize that I just wasn't able to put together a meeting in between. I'm very happy. I know we have some sort of downtime. We also have the holidays, but I'm happy to do it. I think what I can say is that I think it's still necessary. I've had a number of conversations with folks at sort of different state levels around the impacts, and generally the group would have a conversation around the impacts on victims and some of the ways in that there's been disproportionately negative impacts through some of the criminal justice policy reform actions that have taken, that have sort of left victims not having quite as much access to information, things sort of falling through the cracks, and just having, I think, less faith, right, in the system, quote unquote, working for victims. And so it was just a conversation around sort of tracking trends for folks, nothing that was more formal than that. But I still am really happy. I think it's still a necessary conversation for some of us who are seeing those impacts. So if you want to put it on the next advisory committee, you can then hold me to task in having had one meeting and put folks together to bring some trends back to you, Susan.
I've never been good at being a school teacher, but if that's what I need to do, I can do that. Your assignment next time. Well, it was interesting what we were just talking about the women not being and girls not being believed. It's kind of not in the same ballpark, but it's kind of in the ballpark. You know, that general idea that there are impacts that we're not, because the crimes, particularly of domestic violence and sexual assault, are so underreported, we just say, oh, those people aren't reporting, but we really haven't dug into, why they're not, and what might be a cause that has brought them to believe that reporting is not something they can do, or they will not be believed, or whatever. So,
and the other thing I would say too that's been interesting, and I know, like Mark, this is one of the things you put into CJPAC, is that the trending data, right, for thinking about like official federal crime reports, like sexual violence, for example, sexual assault is down 25%. That's not what we're seeing in any service delivery. So RAINN and other folks, our coalition, nationally and locally, we're seeing increases. And so I think that part of it is we need to continue to highlight those differences, because I think, to your point, right, so many folks are fearful or are not getting good responses, or the system is not accessible to them. And if we only are following that trending crime data, you are missing the fact, right, that we are all serving folks who are having these experiences, who are being victims of crime, but who are not feeling safe or supported or seen in going through those available institutionalized practices, right? So even those, I think we just have to keep putting that into the conversation also, because it's so easy to just sort of say, well, crime is down right now. And that's not the experience, at least in sexual assault, and I'm assuming domestic violence. Or even homicide, right? We have a 30% increase in homicide in the state of Connecticut, while major crimes are like, violent crimes are down, right? There's just places where we're trending differently than what the data is saying that we need to keep talking about.
Right, and that's what Andrew Woods has been saying to us also, beside Jessica's homicide survivors, is that that violence is just really intense, and it's affecting people that may or may not have had that kind of impact before. All right, so that's going to be on the agenda for next time. So are there any other, I know we're not in legislative time here yet, but there's anything that's coming up, as all of you I'm sure know, that there was there has been federal legislation that's gone through. The infrastructure bill just went through, but the new one is coming up, the Build Back Better. And there's lots of stuff in that might be of interest in terms of crime victims. I know one of the issues that the women I work with is childcare. Childcare allows them to get back to work, allows them to begin to earn money so they can start to move their life forward. And that's always been a piece. So we might want to think about those kind of making sure the information is flowing about that as it comes through the system. We don't know. Anything else about legislative issues? Anybody have anything that they're thinking about so far, or even on the state or federal level?
I think Jerry had her hand up.
Great, thank you.
Thank you, Your Honor.
I see your hand. That's great.
Hi, thank you. I just CCADV's been doing a lot of training on coercive control with Public Act 2178. And I also wanted to just kind of put that out as a opportunity for a future meeting for a presentation to the council if interested.
That would be great. That would be fabulous. Connecticut is one of several states that have passed that kind of law. So it's fairly, well, beside other countries like Scotland has done that. All right. Let's see. Our next meeting is in February. So that might be a place to include that. Would that be good for you, Jerry, and whoever else you want to present?
Absolutely.
All right. Yeah, I was just reading a little bit about Evan Stark in his book that came out many years ago, and now it's the place that everybody is reading. It's really great. All right. Anything else about federal or state legislation proposals or any issues that are coming up? All right. And then the other that we've been, yeah, Megan, go. I'm sorry, I'm not watching for hands, and I apologize for that. Go ahead.
Okay. That's okay. I think there's a couple other hands up too. So
yes, I see them. Yes.
Well, I think related to federal, I know this is something that that Beth and I have been working on in terms of those that are funded via VOCA. We've done an initial draft of a joint letter that we're hoping that other organizations that are funded through VOCA will join us on, in terms of writing a letter to the governor's office seeking funding for one-time temporary funding for the gap. So what we understand is that it is one-time temporary funding that we would be seeking, and a model that has worked pretty well, at least for a couple states. Other state domestic violence coalitions, New Hampshire, Iowa, and Wisconsin, have all done this in terms of trying to come together and draft one single letter to leadership. So we thought we would try to do the same thing if folks were interested. Certainly not mandatory to join onto our letter, but if you are interested, we can certainly help to coordinate that. So I'll make sure, Susan, that you have my email address because I can sort of handle the information flow for those that might be interested in signing on and adding to the letter. So that's, I think, what we're going to try to do in terms of our approach for that temporary issue moving forward, to try to get to the governor's office in a more meaningful way.
Okay, so people should contact you, Megan? Is that what you're suggesting?
If they want to, mscanlon@ctcadv.org. And if you want to contact me, like I said, Beth and I worked on a draft letter, and there's room to add, but also want to keep it succinct, because I don't know that they'll read sort of a 20-page letter, but certainly maybe like a 2 or 3 page letter. So we just want to keep it really high level, but we want to encourage anybody that wants to sign on to sign on. And we would work through with the individuals that do want to sign on what their funding request looks like, so we can put it together as one larger funding request. Is what the approach has been in other states, and it's worked pretty well. So we were thinking we would try to do it in Connecticut now.
I've heard that other states have been doing that, so that's a great idea. All right, I have now figured.
He's got his hand up.
Yes,
as well as Mark.
Yes, I've now figured out I finally got my list up here. So Mark, you want to go, and then Andrew too, right?
Absolutely, thank you. Thinking I'm a little out of probably a little delayed with my point. I was kind of processing and pondering what Beth had shared and the victimization survey that preceded it. And I think looking at the National Crime Victimization Survey helped me to appreciate that according to the respondents, 40% of people who experienced violent crime in the prior 6 months reported to law enforcement, and 1/3 of victims of property offenses reported. And for rape and sexual assault, it was lower, 23%. So I think that really struck me with the realization that victims are living with the physical, emotional trauma resulting from crime. I would say also financial. I can unpack it there, the wide sweeping effects of crime and victimization. And they may not go to law enforcement with the report, but they are finding themselves in other service agencies, some victim-centered, others not, or they may not be able to access it and they're not receiving the support. There was also a national study that came out from the Bureau of Justice Statistics describing victim services and what a small percentage of victims needing services access them. And that's a reflection of what I thought Beth was sharing earlier, that though the UCR could report a drop in rape over the prior 10 years, her member centers aren't experiencing that. She's not seeing that. And I think there are some complex issues happening there in the data. The fact that such a small percentage of people report to law enforcement, such a small percentage of people access services, and the service organizations themselves are underwater. And so I'm wondering if between the efforts to collect greater victimization, victim need, victim service data, and leveraging these other national reports, we could over time develop just a set of data points and measures and ultimately look for larger opportunities to tell the story of victims using data. Because I feel like we're at a time right now where there's a strong desire to better tell the story, and that could have I thought of this because of the impact that could have on the legislative session and policy priorities and budget priorities and longer term. So I wanted just to applaud Beth for raising that and thank the chairs for having this as a topic of discussion.
Thank you. All right, and then Andrew, go for it.
All right, thank you, Susan. Just as a reminder, we still have time for folks that may want to submit a written testimony or even testify before the Gun Violence Intervention and Prevention Advisory Committee. I'll resend this out to Linda if she can get it out to all of our members. The public hearing is actually going to take place on the 12th of November. I'm sorry, the 21st of November. Oops, better get it right. Actually, by the 12th, we need to get the, it's going to take place on November 17th, but testimonies are due by the 12th. However, if folks have late, entries, we'll certainly take those as well, because our report to the state legislature is due by January 1. And so anything that folks can get us, especially from this group, would be helpful. And though it says gun violence intervention and prevention advisory committee, we all know on this call that there are such strong intersections between the various work that we do here on this committee. And so by all means, please see what you can do to submit something that we can help further illuminate what this problem looks like and the solutions associated with addressing it. Thank you.
Thank you, Andrew. And Jessica, I think I've got everybody.
Actually, 2 points. One is, Andrew, have you ever been in contact with Officer Nancy Jordan out of New Haven? She's actually their victim advocate down there, and she runs a lot of their community support organizations. Very similar to what you guys do. A lot of Fathers Don't Cry down there. I'm thinking that they would probably love to participate in this. I just wasn't sure if you had contact with her down there.
No, I'm afraid not. If you can get her information to me, I would love to reach out to her as well.
Sure. I can send you over her email address if that's okay with you.
Absolutely. Thank you very much.
Perfect. You're welcome. And just the second point I just wanted to bring up with what Beth and everyone has been talking about is we actually did some of our number crunch from last year in comparison to the past 5 years. We kind of noticed some interesting trends, especially for 2020. While our number of people was down a little bit from previous years, the types of services that we provided were up and all over the place. It was very, very interesting. And we're still trying to figure out exactly how to take those numbers and make them work and put them out there. But one of the things that I did just want to make everyone aware of, because this is something that's terrifying for me personally, is in 2020, even with lockdown, there were 157 homicides. That's more homicides than we've seen in this state since 1996. And we're already on par for this part of the fiscal year to even go over that. That is terrifying, and it's going to have repercussions that are going to spread across the board. So I think the way the data is coming out is very interesting. If you would have asked me that I thought that number would have been as high as it was last year with lockdown, I would have said no way. It was really, really surprising for us to see. And our next step is, once we haven't gotten our 2020 numbers from the medical examiner's office yet, but part of what we're looking to do is to kind of break down what kind of homicide it was, whether it was domestic violence, it involved youth, it involved, the weapons that they use. We're trying to break this down to kind of get an understanding of why this jump has happened the way that it was.
Wow. And that's something that Andrew has been bringing to us too, is trying to understand that particularly in terms of gun violence. It'd be a great report to make to us, Jessica, from Strives of Homicide when you get the data together, because I think it begins to pull some of the other strings that we've been talking about today in the service, not only the needs assessment, but in service delivery kinds of issues. All right, and that sort of brings us back to our COVID-19 conversation, because these trends are popping up in different places. So does anybody else have any other, anything? I'm assuming, I know Melissa's not here from the judicial branch operations. The court operations are moving forward. I don't want to use the word normal, because I don't know what the word normal means, but I know from Jim's report about the fines being up, the report of the number of fines that have been collected. Any thoughts about that? Any places where the court system is still not operating where it would like to be, or any concerns with it?
I can briefly report on the issue of, I think some of the questions that people have had are trials going forward? And yes, trials are going forward. There is a large movement to try to get cases moved to trial if people want trials, and that they're making tremendous efforts. We've had a lot of conversations about the protocols, the safety protocols, the things like that. We just finished our first criminal jury trial in New Britain just this week. I know they're going forward in Hartford. I know that that's something, I'm sure if Melissa was on the call today, that she would be reporting. We understand there is the backlog, but we are moving forward in that direction. So that is something that I think is encouraging for those people who are having to wait to see what happens with the cases that they're involved in. That is happening.
Right. And Linda, do you have a comment there, or do you want to add something?
I was just looking at Megan just wrote something.
Okay.
So yeah, I was chatting with Mary, and she obviously confirms what the judge said. Our victim advocates are seeing much more of a return to in-person hearings. There are some locations that are still providing virtual options for victims, but as was through the duration of this pandemic, access to that technology has been a real obstacle and continues to be an obstacle for participating remotely. I know that we talked last time, and I think Beth brought it up about, I think she's jumped up. Oh no, hi Beth, sorry, about the COVID discount, or either Beth or Jerry, I know, and that's, Judge, I know that's probably a hard phrase maybe to hear, but this is really what the victims are saying, that there's such a, not to say that, Judge, that you haven't heard that, sorry, but utilizing some irregularity is perceived that the factor in the reduction of offers to increase the number of cases resolved. So we're really seeing this throughout all of our work with victims, and, Jess or Jerry or Beth, if you want to say something, but those are what we were seeing. And in fact, we're also seeing the continuation of bond reductions, which is also a huge safety issue for victims. And there's an increased number of increased utilization of diversionary programs, which would have been denied before, pre-COVID, and now they're going forward with this. So try to again keep people, get the system moving in ways that maybe not necessarily really be helpful for crime victims.
Yeah, Linda, you hit on everything. I mean, that we're seeing. I would echo everything you're saying, and the same things that we're seeing in terms of just how quickly things are moving through, that they're not being taken. They both feel a bit like they're trying to move things through quickly, but they're also not being taken as seriously as they would have otherwise. And to the point of cases and what's moving through the courts right now, we have so many victims who are hearing that their cases are not meeting the high threshold, right? So it's not the murder, it's not the sexual assault, like the guy in Rockville, like the things that are moving through are not the things that most of our victims and survivors that we work with would have normally be moved through. So I appreciate all the work, and I know that it is not about individuals impacting it in a way to try to cause harm to victims or anything like that. But there's just such a way in which there's such a negative impact on the victims and survivors right now that we are currently working with, who are going through and using the criminal legal system, that more and more and more on a daily and weekly basis, what we are hearing is folks just turning away from that system altogether, in realization that participating in it will not ultimately get them any of the outcomes that they had hoped to get. And that, I think, again, over time, which you and I have talked about, right? Like, we are going to see less and less. If there's less and less buy-in over time, you will see those ripple effects for years to come, where communities are going to continue to share, not to opt into these processes because they are harmful and they are not getting good outcomes. And that's my larger feel, is not just fear, not just what's happening right now, but how even more communities are not going. It's going to be more underreported, more underprosecuted in the next 5 to 10 years based on some of what's happening now.
All right, adding to our list of issues, and it's a very, very good articulation of how, and that's what I sort of said this as a joke, what's normal? Is that normal to go back to that, or is that going to be the new normal? I don't know. And if it does wear away from the people's belief in the system, then you're right, they're less likely to report. All right, any other comments? Andrew, I'm sorry, I'm not a great Microsoft Teams person, but I now figured out the different things that are here. Megan did put her email into the chat if you're interested in that letter she talked about. Jerry, you have your hand up? Go ahead.
Yes, thank you. I just wanted to agree with what Bethany and Linda had shared. I know we're still hearing from our advocates too, in many locations that victim survivors are not even aware of that cases are being disposed of. Our advocates are not even aware. We do have a couple locations, and I know I've mentioned this on other meetings I've been on, including the CJPAC Victim Services Subcommittee, that we have one location where the judges are actually contacting our advocates to let them know the case is down to be disposed of, to make sure that victim contact is being made, and we definitely appreciate that. But that's been a challenge. I have shared in other arenas that our work with CSSD and their build out of their data system has been wonderful in allowing our advocates to get notification electronically for arraignments and victim information, so that we can make contact and send that information, victim input, back to CSSD the day of arraignment. I'm hoping at some point we might be able to have some conversations about other opportunities to be able to make sure that victim input is getting to the state's attorney's office. Because again, that's another challenge that we're hearing. We have advocates running around the courthouse trying to get victim input into a file that is moving around the courthouse. But again, those are some additional challenges we're experiencing as well.
Great. And then also, Jessica, you had your hand up. Go ahead.
I just wanted to mention that, and actually I'm grateful for this after hearing people share, is, because of the severity of most of our crimes, we don't see a lot of cases that are being disposed of. Maybe one trend that I tend to be seeing is that people aren't taking plea bargains as often as they used to pre-COVID. They're just taking it to trial. I guess a variety of reasons. They could figure, well, COVID could hit again. They might dispose my case. I might get out of jail. They may figure they have nothing to lose at this point. I think maybe the only thing that I've noticed, and again, it's hard to tell if it's because of COVID, because we've noticed this since the penalty was abolished because it was a bargaining chip, that a lot of the plea bargains we're seeing offered now tend to be a little bit on the lower side compared to what they used to be, but that's just, it is what it is. So it could be 30 years as opposed to, 45 years as a starting point. So those tend to be the biggest things that we're seeing now. Juvenile crime is a whole other thing. I'm not even getting into that right now, but that's also probably the biggest trend and problem that we're seeing right now is our offenders are getting younger and younger and younger as the days go on. And as we all know, with the juvenile laws, the information that people can find out, victims can have, their participation in the process, all of that is a very gray area right now. So that's something that is a concern and is on our radar.
Okay. Any other conversations? Mark, did you have your hand up? Good.
Yes, please. Thank you. And I was wondering just if there's, I'm thinking about the input we heard from agencies and organizations with court-based victim advocates. I'm wondering what are, given the concerns that you're hearing from your victims and survivors, I've heard in your updates that victims aren't being notified, that cases are being resolved. I'm hearing that cases are being continued repeatedly and then suddenly being resolved through a plea negotiation. I'm hearing a lot of this confusion about virtual hearings, in-person hearings, all the hard work that a victim must do to summon his or her strength to go to the court or prepare for hearing, then have it be continued. I'm just wondering, it sounds like a lot of the challenges are coming, so a lot of the concerns you're hearing are being expressed by court-based victim advocates. Are there practical administrative changes that could be made at that particular intersection point with the victim advocate, or could anyone perhaps guide me toward what are the right intersection points where we could make some administrative improvements?
Melissa's not on the call today, who's the court operations, so that may be a question to direct to her. Anybody else have any thoughts or suggestions?
I mean, one of the things that I would love to connect more about is like some of the stuff Jerry's talking about with the just sharing of information, right? Like one of our biggest challenges is even with our post-conviction advocates, we don't know if there's a no contact or protective order in place. and there's such a lag with getting the information, but we don't as advocates have access to the information. So there's just lots of places where it seems like a practical application of just better communication built into some of these systems for external folks, right, who are not embedded in the system would be one of the easiest, I'm saying easiest, not that I'm sure easy at all for folks doing it, but like one of the simplest changes that would make the biggest impact is just access to information for folks who are supporting and working with victims. Like that's one of the most basic things. And then the other thing I wonder too is about our ability to capture information in similar ways, right? So even the way that we collect data points, there's got to be ways in which information sharing and data across systems can be simplified if we are using the same definitions or have like the same, we're not all going to use the same quote unquote forms, but we have to institutionalize something standardized for us to all be able to use it across organizations and institutions.
Yes, the cross data. And Jerry, and then Jessica.
Thank you. And I was just going to add, I mean, I mentioned about CSSD and our work with family services and getting that arraignment information electronically. I think the victim input to the state's attorney's office would be important because, again, I know they're kicked off the e-prosecutor system, I believe it is. But I think, you know, other than us sending emails or, again, chasing files around the courthouse to find a file to put victim input into, if there's some way at some point the system can include the submission electronically of victim input, I think it would be helpful for everybody, including the state and victims making sure that their input's being heard or received.
I agree with a lot of what's being said. I also think in the reality of how things happen from what we see, a lot of times we get those or we don't, but the prosecutor will get the write-up from the victim's position and it gets slipped into the file. And if everybody has had a chance to go to a criminal court and you see the stack of files that a prosecutor has, it's if that one piece of paper goes into one of 100 cases that's being called, how do you draw attention to it? I know that some districts are really good. They actually write the victim's position on a different colored piece of paper. So it goes in the file. So then when you see that, you know that there's something in the file that's a little bit different than every other piece of paper that's in the file. So I think there needs to be a conversation about that. I mentioned this at the last meeting about the type of training, and then Susan and I spoke about this yesterday, is what judges get trained on, what they need to be aware of in terms of the Victims' Rights Amendment, what victims' rights are in terms of when they can address the court, what the scope of their ability to address the court is, the manner in which they can do it. And also, I think there's also a conversation that probably all of you could be helpful to us, and that is, what are the kinds of things that victims feel comfortable when they are appearing in front of a judge? Because I tend to understand that if you're making a statement in front of anyone, there can be some sense of apprehension, you're nervous, and if you're talking about something that is traumatic to you, how do you start that conversation? How do you get someone to advocate? How do you get someone to speak on a subject that is really personal to them? Those are all things that I think from our perspective that we can continue to work on. And I know that we do talk a lot about it. And I know that I've spoken to some of you about these issues, but it's something that's ongoing. The communication issue about when somebody wants to be and wants to participate in a case, we have to make sure that we do better so that they are involved. And I think the complication, and I won't go, we could talk a lot about this, but the complication of doing things remotely has also added to the problem, because we have a lot of people who do not have computer access. We have people who don't have, who don't want to have their name on a Teams meeting at the bottom and be looking at the person who is the defendant in the case who traumatized them. So we've worked on things to minimize that. We've actually tried to figure out ways to get people to come into court. We've set up computers for them, but we also, when we know that someone's involved, if they are not on that Teams meeting and they want to be, the case gets continued. And I understand that's frustrating, but if somebody wants to be part of it, they have a right to be there. And I know that that continues to make people frustrated because why didn't it happen today? But if we have someone who can't log in, they still have a right. So those are, it's just an added thing that COVID has presented us with, but we are talking about it. We're working on it. We're trying to make it better. But any input that any of you would have, if you want to have a conversation, we do have training. Those are the kinds of things that we can obviously speak to the other judges about so that your concerns are heard, and we can try to make the training better. But it is part of the training that we do have as judges.
That was the conversation that the judge and I had, was would she like to do a presentation in broad terms about, you know, what is some of the training and how is it set up? And I know some of you know something about that. Some of you have been involved in that, but there's just pieces that seem to be in different places that maybe would be great to pull together. So I would welcome that. We have so many topics to talk about. It's great here. Let me just do Jessica. She's had her hand up, and then we'll move to our new business and keep ourselves on time here. Go ahead.
So I just wanted to mention that's something I would be incredibly interested in helping with. In the past, we were really lucky to be part of a larger group that did a prosecutor training a few years ago. This was probably the year before COVID. And just kind of what I focused on are, you know, even wording, language to use with victims, things that make them feel more comfortable, you know, common barriers that they feel like they face that could be traumatic for them. Just having a basic conversation, because unless you're a victim of a crime, you might not know what to say. You might wonder, and that's okay. There's nothing wrong with that. So we try to do a lot of these one-on-one, very personal trainings, and our goal is to make people feel comfortable as they can in speaking with victims of crime. So I just wanted to mention that. I would love to participate. And then in response to Mark's question, I kind of have an odd thing that was brought up, and I know that because of the law, it's probably something that will never change. But a barrier that we often face sometimes are morning continuances. So say for example, I have a family that just rode in from Brooklyn. They've been up since 4 a.m. taking the trip in, and they get to the courthouse and sorry, it was continued 10 minutes ago because the defense attorney had to go do something else. Well, they're angry and they have a right to be angry for that. And they said, well, you know, why aren't they required to give 24 hours notice if they need to do a continuance? Unfortunately, it's just the system at hand. But since COVID, that's something that I'm noticing is happening a lot more frequently. And Beth actually made me think of it when she was discussing about sharing information and having access to that as well, because, you know, is similar is that we don't have access to that information either. And it's something that there are times that I've had advocates getting in contact with our members and myself at 7:30 at night and don't have them come in tomorrow. It just got canceled last minute. So now everybody's stressed out because it's 8 o'clock at night and some plans have changed very quickly. So I just wanted to mention that. I don't know if there's a way around it. I don't know if it's an answer. It's just something we've been seeing.
Interesting. All right, we have a lot of topics. This is good. And what is really great, and the Judge Baldini and I talked about this yesterday, her coming on as a co-chair, that I have tried over the years of being a co-chair, and also when other judges have been part of this group, talked about how we could keep the meetings interesting, have it be presentations that people are looking for, or just the idea that we have a round table here of people that may not always be in the same time in the same place. So what would be the thing that would be something you can present? So I have a list here of, I've been making little lists of the topics that are coming up for, we'll have a meeting coming up in February the 8th. At the bottom of your agenda, there is a list of the upcoming meetings that go all the way to, well, a year from now. So first of all, Beth's going to report back on her fabulous small group discussion, which I have been anxious to hear. Jerry is going to talk about coercive control, some updates on that from the legislation. We can have a legislative update that will session have started by February or the very beginning of session. So that's a chance for people to bring to the council what they have in the legislation hopper that coming up that session, and any intersections that their legislation might be with other entities or groups or people who are on the council. That'd be great. I'd like to keep Andrew, I think you're still on, yeah. The gun violence, keeping us up to date on what's going on, particularly coming out of the hearing that you're having. Love to hear this. And I think what's interesting is we're starting to pick up pieces of data we want to put together in a place. And I think that's what will be happening. And I'm going to have Linda, I should have asked this when Adam was still on. So by February the 8th, I know he said that the final assessment report, victim assessment report, is due later in April. We do have a meeting in April. February would be another update for us, particularly on the interviews. Is that what I understand correctly?
I believe by February, we'll have we won't have the final report. Again, as you said, it'll be in April, but we will begin to have some rough data that could be shared and discussed.
And then April 12th, which is our meeting, which is before the final report is due, we could have some sense of the final report, or at least to know what's on the table there.
I believe so, yes.
Okay, all right. So what I'm hearing, I know when I was in state government, was always this very interesting thing about sharing data across agencies. And I think we just did we kind of played it out a little bit here. So thinking about what data, particularly maybe it's anecdotal, that's particularly that many of you talked about in terms of victim advocacy and what's happening in the courtroom, but any other way we can, Jessica's got some data from survivors of homicide put on the table, just trying to think about how that would come together in some kind, I wouldn't say in a report, but just the ability for us to share and maybe to fill in some of the blanks that we don't know. So it's not just an anecdotal thing, but there's some numbers or some kind of assessment. I think that's everything I have on my list. Is there anything else? Oh, the other thing I wanted to say is that two other things is that if there's any other agency organization that's on our council would like to contribute a presentation or whatever. I know Ebony from Correction. Is there anything we haven't sort of talked about the correction system sort of piece of this? And I know Bob's not here from MAD, but they've been doing some incredible work at MAD. So I'd like to, and then Yvette on human trafficking, just thinking about what you could bring to the council and share, and not only have a chance for people to interact about it. So please think about that in your spare moments. Or when something comes up and you're saying, oh, that'd be a good thing to bring to the council, just so that we can continue to really take advantage of the time that we spend together. All right, any other new business? Anything else that people? All right, hearing none. We do have February 8th. I believe, Jeannie, that the slides that you showed today are available. They'll be sent out?
Yes. Yes, email them out to the members.
Okay, great. And anything else, if you'd like to flow through Jeannie, that'd be great. She's a fabulous note taker. I have little scribbles here, so I'm waiting for her notes to fill it in. So, all right, thank you so much for the conversation today. I know it's a little bit funny to do it on virtually. We have talked about whether and this is a conversation that I'd like people to also think about continuing these meetings virtually, or if and when we'd be back in person and how that would work. We don't have to make the decision, but it's been interesting. I think we still have had some great conversations, even though we're not in the same room. So I really appreciate that. And
Susan, I just wanted to say that we're really still under a directive by Judge Carroll to not have in person.
Okay.
So I'd be very happy, and Judge, you probably will hear about that before I do. But once that happens, we'll certainly send that out, and you and Judge can make a determination if we come back in person.
Well, I think that's it's a conversation too, that there have been some advantages to all of us being here virtually, and there's some advantages to not be able to sit in a room and have a little chit chat on the side. So we could have, if we were on Zoom, we could have breakout rooms, so that would be fun. All right. Anything else before we adjourn? All right. Thank you so much. I want to thank Judge Baldini for being here, for being a part of this, and so that's now a virtual co-chair, which is great, and that's really fabulous. It's really helpful, I think, to everybody, not only to have you here, Judge, but also to hear some of your direct experiences. That's really great. All right. Is there a motion for adjournment?
I'll make the motion for adjournment. This is Beth.
Okay, Beth. And a second?
Jerry, I'll second.
Okay. All those in favor, or anybody who's not in favor, raise your hand. We're all set to go. All right. We'll see you in February. If you have anything to add to the agenda or to any questions, please send them through Jeannie. That'd be great. Thank you so much to everybody. It's been a great time, and we're out of here 20 minutes early. So take those 20 minutes and have a good life.